Duchenne muscular dystrophy, or DMD, is an X-linked recessive disease that affects 1 in 3,500 young boys. Because this disease is X-linked recessive, it is very rare for a girl to be born with it, because boys with DMD usually don't live long enough to father children. Patients who have DMD experience a continuous decrease in muscular strength due to the loss of muscle fibers. When most people think about Duchenne muscular dystrophy, they normally think about the effects on skeletal muscle, such as being unable to walk far without help. However, DMD has effects that are non-skeletal muscle related on patients that aren't as well known, such as reduction in respiratory and cardiac muscle strength, scoliosis, and in some rare cases, fat embolism. The combination of these problems within the patient's body will eventually lead to the patient's death before their 30s. Cardiomyopathy is one of the main causes of death in patients with DMD. Due to the degeneration and regeneration of muscle tissue, fibrosis of cardiac tissue will thin the heart's walls and eventually cause a decline in the heart's function. Because cardiac muscles have less regenerative ability than skeletal muscles, it is important to monitor them with an electrocardiogram or echocardiography to look out for subtle changes in the heart, as early treatments can help limit the cardiomyopathy progression. One device called the cardiovascular magnetic resonance, or CMR, can help monitor the earliest signs of cardiac changes, such as left ventricular strain defects. Treatments with a drug called eplerenone has been shown to reduce left ventricular strain defect. Together, these methods can help slow down cardiomyopathy progression. Next is the weakness in the respiratory system. The respiratory system consists of mostly smooth muscles. As muscles weaken and decrease during progression of DMD, the ability of the body to breathe properly decreases as well. With weakness in the lungs and in the diaphragm, patients with DMD are susceptible to infections and pneumonia due to their inability to cough and clear the breathing passage of foreign particles. Some symptoms that a patient is having trouble breathing is if they are often tired or sleepy, have problems paying attention, are short of breath, and wake up with their heart pounding. To reduce the severity of this, respiratory and pulmonary care is necessary for DMD patients. As DMD patients reach around 10 years old, they most likely will need a machine to help them breathe. Some treatments that can help reduce respiratory rate and improve breathing are non-invasive mask ventilation, cough assistance, or tracheotomy. Close to the airway is the esophagus, which is also negatively affected by DMD. Because the esophagus is also majority smooth muscle, the decrease and weakening in muscles in the body leads to patients having difficulty swallowing. As treatments for patients with DMD allow for them to live longer than before, finding ways to deliver the proper nutrition is needed to care for the patients and ensure that they can have a good quality of life. Patients with DMD have difficulty moving, so they have to sit down a lot. This makes them susceptible to developing scoliosis, or a bending of the spine to the side. This bending in the spine makes it so that sitting can be uncomfortable due to weight being distributed unevenly. Once scoliosis is developed, the only way to correct it is to have surgery. However, there have been improvements in wheelchair design so that scoliosis doesn't develop as quickly. Researchers have also found that an improvement in posture, retaining ambulation, and steroids can help deter the development of scoliosis. Lastly, fat embolism syndrome, or FES, is something that is pretty rare, but researchers are not sure whether that is because it is actually a rare occurrence or because it is not reported enough. It is not a specific DMD effect, but since patients with DMD are more prone to injury, FES can occur. When a long bone fractures, it causes the fat inside the bone to be released into the bloodstream. The fat then travels to the heart and lungs, and when the fat reaches the lungs and lodges itself there, FES officially starts developing. Some major symptoms of FES are shortness of breath, headaches, comas, confusion, and seizures. FES can quickly become life-threatening, so if a child develops symptoms of FES after a fall, it is recommended that they be taken to the emergency room. Parents or caregivers should tell staff about the possibility of FES, since FES is so rare and not often thought of immediately. Hopefully, this video gave you an insight of symptoms that occur due to DMD other than skeletal muscle weakness. Please share this with your friends, family, and peers so that they can know what to look out for if they possibly have a child with DMD. Finally, remember that September 7th is Duchenne Awareness Day. You can release red balloons to show your support and awareness of DMD. In addition, cureduchenne.org and parentprojectmd.org are both sites where you can find more information about DMD.